Quickly, let's talk about cough and catarrh in babies. This cough and catarrh keeps coming, it keeps going, you keep buying drugs, and it keeps reoccurring. So you're wondering what could be happening. There's an aspect we need to talk about, especially as mothers. When it comes to general safety, when it comes to someone coughing around you, someone sneezing, you're expecting that person to cover their mouth, to cover their mouth when they're coughing, they're sneezing. That person should wash their hands. That the person should discard the used tissue properly. This is because when you just cough like that without covering your mouth, what happens is that you're releasing secretions everywhere, and these secretions carry droplets. And these droplets are the ones that carry the bacteria, the viruses that can spread to cause other people to come down with these infections. So just imagine that is what is encouraged to prevent cough and catarrh. So as a mom, we have this thing as mothers, we have this, this is my baby, mother's love and all of that. This baby is having catarrh. As a way of expressing your mother's love, you want your baby to breathe, you want your baby to feel okay. So you go on and use your mouth to now suck out the secretions. Remember, the secretions are the ones that carry the droplets. These droplets are the ones that carry the microorganisms that cause these infections. Before you know it, you as the mom, you're already coming down with catarrh. And when your baby's own is trying to resolve, as your baby's own is resolving, before you know, you're already infected as the mom. As your baby's own is resolving, before you know it, you really want to now infect your baby. So this is one aspect that can cause recurrent catarrh in babies. So you suck out the secretions with your mouth. Before you know it, you are down with catarrh. By the time your baby's own is resolving, you really want to transfer a new cycle of infection to your baby. And this cycle keeps going on and on and on. So are you supposed to leave your baby helpless? Are you supposed to leave them not to breathe when they are struggling with catarrh, when their nostrils are blocked and all of that? No, you're not supposed to leave them helpless. It's simple. Just get a nasal aspirator. With that nasal aspirator, you can suck out the mucus. When you use your mouth, you're actually infecting yourself. When it comes to babies, they cannot remove these things by themselves. They can struggle with blocked nostrils and all of those things. So get this aspirator to aspirate it. If the nostrils are looking dry, you cannot suck out the mucus and baby is struggling to breathe, also get saline drops. So as you're getting your nasal aspirator, also get saline drops. So what the saline drops basically does is that when the baby's nostrils are blocked, and you're seeing that the mucus are dry, so use your saline drops to soften the mucus. After the mucus is softened, you now use the nasal aspirator to suck out the mucus. And when you're done, you wash the nasal aspirator properly, you wash your hands, and that way you're not infecting yourself, you're not infecting your baby. At the end of the day, also preventing your baby from getting the infection. So when it comes to babies, when it comes to recurring cough and catarrh in babies, this is the one aspect we consider as mother's love, but it is doing more harm than good. It can be a source of recurrent infection when it comes to catarrh in babies. So when it comes to helping your baby breathe better when you're struggling with catarrh,